the first step in managing that is we make sure that we look at diet considerations. Because if someone drinks the 4 cups of coffee in the morning and they're peeing a lot, well, that may be normal. If you're drinking a gallon of water in the morning, it's not a health hazard that you're peeing all the time, right? We go over diet considerations first, okay? And especially if they're getting up at night, tell them, hey, limit your fluids after dinner. Avoid alcohol, caffeine, spicy foods. The second step, or in managing this, is medication. So you either do like Detrol, Enable-X, Vesicare. All those are anticholinergics. There's a new one out, relatively new, called Myrbetriq. And so that's a second-line therapy. First is behavioral, second-line therapy. But let's say you have a patient that's tried behavioral and they're doing their right thing, they're avoiding alcohol, caffeine, and spicy foods. And then the second thing, they've been on, let's say 2 different anticholinergics or an anticholinergic and Myrbetriq. Usually you have to try 2 and have failed those for at least, I think, 3 months, something like that. And then they're still having bothersome symptoms. Well, the third-line treatments for this overactive bladder, one of them is called posterior tibial nerve stimulation. And what that entails is, it sounds like voodoo, but it works. They basically put a TENS unit, they put a needle electrode in the ankle region medially, and it's about, 30-minute session? And it stimulates the nerve to modulate the bladder's response, okay? And it works, especially in some patients. You can have dramatic reduction in frequency and urgency, and in some cases nocturia.